G'day, Agent Mahara here. Do a comment response, and this is probably going to be slotted into my Surviving a Borderline podcast, which will sometimes feature me here in video. Oh, goody! And it will often have podcasts where it's just audio. Commenter left their experience in a comment and a lot of information about what they're going through with somebody with BPD in their life. They left a comment on the video I did, why borderline split, rage, and punish you for your love. The commenter says, thank you for all your insight and support for people with BPD loved ones. I suspect my adult daughter may have it. Her father was confirmed BPD with strong narcissistic traits and abusive tendencies. I suspect a genetic link. There's much resemblance in her behavior. Well, again, I believe in my best expertise and what I've read and what I know about all the studies that are going on right now, most of them pseudoscience, not replicated, etc. We don't really know if it's definitely not all genetics, and definitely there might be some genetics in there. I've heard different percentages of heritability thrown around out there. But the key thing to know is it's not 100% genetic. So at least it's not known to be 100% genetic. And when you mentioned that you suspect it's a genetic link because your adult daughter with borderline personality disorder or all the patterns of, but she won't get diagnosed, meaning she doesn't want to cooperate. You said there's much resemblance in her behavior. He abandoned her when she was 2 years old. For many years, she suffered due to not having a caring father in her life. Yes. And by the way, this isn't something I've had the opportunity to speak as much about as a lot of the kind of content that I am talking about. Because what's really important here so far is this is a mother commenting about an adult daughter with suspected BP, all the patterns of behaviors, but she won't agree to go and get assessed. Well, the abandonment from the father is some percentage of genetic link or not. The abandonment from her father could be the core wound of abandonment that kind of sets into play a lot of things that will go wrong or happen or be misperceived by an infant to a young toddler. And so it's not always mother, and it could be the abandonment wound from father. And the other thing too is that perceived abandonment, though she had actual abandonment, but she had you there being good mom and everything. But sometimes I don't think that really helps with the abandonment wound or the abandonment trauma, even if it comes from dad and that kind of abandonment and not mom. Yeah, you said that her father abandoned her when she was 2 years old. That's right around that time where that kind of abandonment wound is really gonna, unfortunately for a lot of people, end up in being the patterns of and or diagnosable borderline personality disorder. For many years, she suffered due to not having a caring father in life, then turned her heart stone cold in self-protection. Yeah, so for many years she was suffering, right? Beginning around the age of 2, she was suffering. And then when you say turned her heart stone cold in self-protection, well, I'm sure you notice some change there, but this is what kind of happens as people with BPD get a little bit more into and as they're trying to go through childhood, which of course they get through childhood, but not emotionally, not going through all the early stages and stages of childhood development. And so she may have had an emotional rest, maybe the abandonment from her father and or perception based kind of issues, because it's not all genetics. And the other thing that can happen sometimes, though it sounds like it really is about her father and that abandonment, like I just said, but sometimes also, you know, some people are born with extra sensitive temperaments. And then, so even when good mom, like I'm sure this commenter has been the best mom she can be and isn't a cluster B or anything. So even when you are being mom, you're the mother of the child, but then there's that abandonment wound at the age of 2 by her father. But the thing is, she might have been born with a more sensitive temperament as well. and that happens for lots of reasons, but it's not your fault. Then the thing is that she could have had a higher needs threshold than the average child would have had. And then her father, however he behaved in those first 2 years of her life, and then he abandoned her. And so whether that's the actual abandonment trauma of the actual abandonment, or whether it's the perception of the abandonment, that because she was suffering, because she was missing a dad, or dad, like you said. Sounds like that's really sort of the causation factors here for the most part. So then she turned her heart stone cold in self-protection. And I don't know like what age that would have been. It would be interesting. And at whatever age you saw that, it's probably like that was happening inside of her. And as you said, she was suffering a lot because she didn't have a caring, loving dad, and she'd been abandoned by her father. Well, there comes a time, and it's not always going to show at the same time for everybody with BPD, when they do just kind of slam, like the wall goes up. The defenses are getting stronger. Well, they're maladaptive, but they're very much needed for the false self to protect for the survival of this person emotionally, even though you were there. But it's kind of like how much of that wall of protection that she put up really kept her from taking in what you were actually giving her. And you said she was also bullied in junior high school, though I supported her as much as I could in her struggles. I raised her on my own with my late mother's help. Although she was loved to pieces, cared for, supported, even spoiled in attempt to somehow compensate for the abandoning father, today I'm blamed for everything that goes wrong in her life. She constantly hurts me somehow, as as if to provoke a fight, then says I'm impossible to live with if I react and defend myself. I'm really sorry to hear that, because I guess one of the things, and it's really, really hard, really difficult, is I don't know if you've got some education on this. You may well have, um, as a mother of someone with all the traits of BPD, but just who won't go get assessed right now. What you're sharing here is that, well, you said somehow as if to provoke a fight. She's probably definitely trying to provoke a fight. It's conflict, it's drama, it's something that happens unconsciously in an attempt, or the reason behind it is the unconscious attempt to assuage all of the pain and everything being felt inside. I'm just explaining, not justifying. And so everything that goes wrong in her life, she constantly hurts this commenter, who's her mother, to provoke a fight. Says that, well, she's projecting when she says you're impossible to live with. It sounds like for sure that she might be the one rather impossible to live with. And you get punished with her mood swings and silent treatments. Oh, and just before that, you said she says you're impossible to live with if you react and defend yourself. There's something to think about, because you want to be responding, not reacting. So a lot of time you might not even respond. So this is something to look into, learning more about, that you want to not always respond at all, depending what's happening. And if you're going to respond, you don't want to be reacting and defending yourself. Oh, I don't like delivering this news, but to a mom of somebody with BPD who yourself, you don't have cluster B, there's no sense defending yourself. It's only going to make it worse. And so what might help you, I'm out here to work with anybody in this way also, if you just need some strategy, some understanding, some help with how to actually, when not to respond, when to respond, but how to not react and not defend. Because it just doesn't help anything. It's a natural thing to want to do for yourself, but it's not really going to help you in the long run in terms of how she reacts and punishes you. And it's not going to change a darn thing about what she's doing. So you need to look into how to respond and when not to respond, which, yeah, that might get her all worked up some more, or she will in response to that. But this is how you can start to build boundaries so that you're not always, so A, you're never reacting. That's the hope. And B, you're not defending yourself. And C, sometimes you don't respond at all. And then if you're going to respond, it's not a reaction. So that's something to work with someone, learn how to do that, because that'll definitely at least help you if it doesn't change anything in how your daughter relates to you. And you said she's constantly on edge, contrarian, and passive aggressive. She can be very cruel, condescending, very self centered and controlling, lacks empathy, blames all her misfortunes on me, turns me into the quote villain unquote whenever I try to talk to her and hold her somehow accountable for her words and actions. I'm just really sorry to hear that, because yes, all relationship types, to anybody with BPD and going through these cycles and this type of abuse, and really it's abuse, it's horrific, it's terrible, it's traumatizing treatment of someone, and it's bad in all relationship types. But for moms like yourself, and let me be clear, moms out there who do have an adult child with BPD, but they themselves don't have any cluster B personality disorder, I really feel for you. There's some things I think you could learn in strategy that might help you to cope. And that's what's most important at this point, actually, because you can't really you tried to hold her accountable, it doesn't work. She's out of control and she's hurting a lot, and she had a young woundedness that wasn't your fault. And so you're not going to be able to change the relational dynamic a lot or much. But what you can change in how you're approaching this, how you can cope better with it, learning strategy, etc., will really help you. Because I know when we get to the end of this comment where you're at, and how for moms who are relatively healthy and certainly not cluster B personality disordered, there's that more difficult aspect of, not wanting to go no contact. You want to be there for your child, your adult child, no matter what. And a lot of moms feel that way, the non-cluster B moms. And so how can you help yourself to be not sort of in such a reactionary place and defending yourself? Because believe me, it might not make a difference for your daughter right away. It could help a little over time, but it will really help you to change your stress levels and how you're kind of feeding into her attempts to start, well, drama, conflict, discord, stress, if not a fight. And that's what you need to learn more, if I may suggest, about how to not be at all reacting, which is difficult, but you can learn that and you can practice that, and it will help you. So many people with BPD, by the way, they can be very cruel, condescending, very self-centered and controlling, lacking empathy, and turning the person closest to them, so in this case it sounds like it's you, mom, into the villain. And that's clearly in your daughter's life. From what you shared here, sounds like dad is the villain, but dad's not there. So right now, you kind of represent both mom and the abandoning father to her, unfortunately. And you say that you're trying to talk to her and hold her somehow accountable for her words and actions. And you said, I try to make her look inward with some self-reflection in search for some deeper connection with her own feelings. Well, when you say that, I just made the screen jump here. So that's not really your job as mom. That's a therapist's job. And in the absence of, if she's not wanting therapy or help, then it'd be important for you to, there's this whole way of not reacting, sometimes not even responding, how to respond, when not to respond to what, when what's happening or what's not happening, that I hope you'll learn more about. And like I said, I'm out here to work with you on that if you'd like, but you could choose someone else also too, obviously. But the other thing is that when you're trying to hold her accountable for her words, and you're trying to, well, how did you put that? Just, yeah, you said, I try to talk to her and hold her somehow accountable for her words and actions. And then you said, I try to make her look inward. And, even though you're mom and I understand, it's like There's some codependency. You're trying to make change in her. Can't do it. Can't do it. Unless she wants to go to therapy, it's going to be how it is. And so you need to change your approach as much as you can in ways that, I could help you with, or someone else out there could help you with. Because trying to hold her accountable, trying to make her accountable, and expecting that you can somehow make her look inward with some self-reflection in search of for deeper connection with her own feelings, you say, but usually to no avail. Well, yes, because somebody with BPD or all the patterns who hasn't been diagnosed yet, what the thing is there, what the really difficulty there is that in BPD there's self-awareness deficits. And so you're trying to help her to make her kind of reflect and get some self-awareness. It's not going to work. So to the degree that that might feel impossible not to do because you're trying to help, that's another thing that you need to kind of just whoa on that. And then you're going to have to learn how to not respond at times, certainly not react, not defend yourself, when to respond and how to respond to what she's doing when you might otherwise want to hold her accountable, quite understandably, and you might want to help her or try to make her self-reflect. That's where you have to be really much more neutral and sometimes really quiet. And she won't enjoy that. But it sounds like you need to be coping in different ways. It can be more effective for you. She externalizes everything through frequent fights, then blames me for the outcome. Yeah, I'm so sorry to hear this. It's like, it's got to be horrible for you and so painful. And yet, there's nothing you can do to change this right now. So all you can do is, like I said, learn strategy, learn some more things about how you can help you to cope with your daughter and everything that she's putting out there, externalizing, projecting all over you, because she's literally experiencing you. She knows your mom, but she's experiencing you as the object of the representation of bad, wounding dad. So she's throwing all that at you too. And then, yes, you get lost in the meantime. She refuses getting diagnosed by a professional, despite my encouragement and declarations of support. She's practically obsessed with her cell phone and constant chatting online and sees no need to communicate with me, although we live together. Well, again, this is really tough stuff. And I'm out here to work for you if I resonate with you. But if you'd like to, or speak to someone else who's an expert in this area, because to what you just said there, sorry, I keep losing my place. It's a lot of text and people don't put paragraphs in. You know what I mean? That would help me keep my place. Sorry, I'm just getting over a cold and I got the dry hack left. Yeah, she's obsessed with her cell phone, constant chatting online, no need to communicate, sees no need to communicate with you. And I'm sorry to hear that because that's really painful also. Well, like I keep alluding to, you need some help to be coming at this from an entirely different way that might feel crazy at first, but in a really different way than it sounds like what you've been doing so far. Not that you're not doing your best, like not trying to say that, but there's another way that will help you. Could it help your daughter in time? Maybe. Would you learning more of the strategy I'm referring to? How it will help you no matter what. That's what's important because you need to be okay too. And your daughter, it may or may not make any adjustment to that because, yeah, she's somebody that really does need professional help and assessment. And I guess maybe, yeah, she's obsessed with her cell phone, sees no need to communicate with you, although we live together. That's a really tough situation for sure, especially since she won't go get help. And I mean, depending on the level of how much conflict and drama and chaos there really is, you have to consider whether or not you could still, or who's paying for the phone. Because if you're paying for the cell phone, maybe you need to start asserting some boundaries, and maybe that phone has to go away for a while. And you might suggest that she might be good if she pursued something or other. But if she doesn't do anything and she just pitches a fit or rages or stays in her room and huffs and puffs or something, You might want to, once you learn more of the strategy I'm alluding to, you might really want to think about, if you're paying for the phone, that she doesn't just get to do that at will all day long. So, that will be difficult. But again, some of these kind of boundaries and changes that you could make that will get horrible reactions might make a little bit of inroad over time. But you need the strategy of coping better with what she does and how she responds before you try that. She's changed drastically in her early 20s due to some unfavorable social influences, and she seems attracted to narcissistic people she apparently views as, quote, examples of popularity and success, unquote. Wow, that's really difficult too. And she's in her early 20s, and now you're seeing drastic changes. Well, this is part for the course, unfortunately. Not that you should just accept that, right? But it's part for the course in BPD, because now she is being influenced more by probably mostly people online. I don't know. And like you said, more narcissistic, because she's going to, unfortunately, it's unconscious for her, but she's going to likely choose somebody who's a lot like her dad. And this is just part of the woundedness expressing itself in another way. And this is true of a lot of people with borderline personality disorder who might have had a BPD or narcissistic or comorbidity, both dad who abandoned them or who was around to abuse them more. Either way, it's pretty, like, it's awful and untenable for a child. And so she's now going to gravitate to people that are like dad, and that's because it's a repetition compulsion. It's deep down unconscious. She's not going to know she's doing this. And really, again, and I hate to say this to any mother, it's the same as when talking to partners in a way. You're not going to be able to change her trajectory right now to repetition compulsion, impulsivity. She has a lack of self. All that she's going through is going to thrust her forward into at least these very emotional, dangerous connections, and the way that she's misperceiving people that are dangerous and likely narcissistic, as you're saying, because she views them, she misperceives them as examples of popularity and success. But you have to remember, unconsciously, in the repetition compulsion cycle of what that really means in borderline personality disorder, she's going to be looking for dad. So she's going to meet a lot of narcissistic and dangerous to her emotionally and potentially otherwise people. I'm sorry to say that, but you need to prepare yourself that this isn't going to be an easy ride, this part either. And then the commenter continues, we used to have such a strong, close, warm, and loving bond, yet today she treats me like her adversary and barely talks to me just because I refuse to be her selfless enabler. Well, good for you for knowing that you can't be her selfless enabler. That's healthy for you. And it's a gift you're giving her that she can't appreciate right now, right? That she can't understand. And I'm really sorry to hear. Like, I mean, sometimes it goes like this, unfortunately, that like you had a close, warm, and loving bond. Yeah, and you were there for her and everything. But guess what? The abandonment by her dad, and at the age of 2, is what this is all about. And it's that woundedness, and and she's not assessed, and she's untreated, and that's just the repetition compulsions of manifesting that over and over and over with everybody is what's going to happen. And what's happening for you, mom, is that you are like, you're her mom and you have this close loving bond. Somewhere inside she knows that, kind of, but like maybe not really knows it anymore, but she won't have forgotten it, but she doesn't know where to park it, because overriding what's eating her alive inside, probably 24/7 to some degree or other, is this unconscious need, like, because she won't necessarily know, but for dad, for dad, for dad, like, because she needs to go to therapy and heal that wound, right? So in the meantime, what's happening is, even though your mom and you have this close loving bond, you've done everything you can for your child, she's got this woundedness from her dad, and So she turns it on you in a repetition compulsion way, which that's an explanation, not an excuse by any means. And you become to her, instead of loving mom that you have always been, you become object of the representation of bad dad. And that's exactly what's happening. She knows you're not dad, right? Like consciously. But in the unconscious, in the woundedness, with the lack of self, and where all this pain is just rolling around inside of her and manifesting with the different behaviors and the, unfortunately irresponsible, no accountability taking, blame you for everything, you become bad object other dad, even though you're her loving mom. And you said, oh, I hear you. You said, my heart is breaking because I can't reach her emotionally. I'm so sorry, because when I work with moms of an adult child or whatever age with BPD, like I could help you if you're interested to learn more strategy to help you cope. But yes, I understand that your heart is breaking because for right now, you can't reach her emotionally. But that's not a forever thing necessarily. And that's where the hope has to lie. And the other thing, that you'll get treatment, that you'll want assessment, that you'll get treatment. And in the meantime, something I want you to know is that, and I'm so sorry to hear your heart is breaking because you can't reach her. And I really understand that. And I've worked with a lot of moms like yourself who aren't cluster B personality disorder and have an adult child with BPD. And that's a gut wrenching thing. It's like all these relationship types are gut wrenching for anybody. But I think, for a mom or a dad, but especially for a mom, but for a dad too could be. But for you as a mom, like this is the most gut wrenching, unbelievable situation ever. And my heart just goes out to your heart that's breaking. And I hear you. And I just just feel so much empathy for you and so much compassion, because you have this road ahead of you that you don't deserve, and it doesn't kind of make sense a lot probably, and it's extremely painful. So the one thing I'd like you to know about this, as the mom of your in her 20s adult child with BPD, or all the patterns of, I want you to know that the other reason why she does what she does to you, which is not defendable, is because even though she's experiencing you often unconsciously as bad, object of the representation of bad, wounding dad, she knows that your mom, and the love might be lost on her part right now because she's in all this, agony of everything from that abandonment wound from her father, in spite of the fact that you were there and you formed a loving bond with her, etc., to the degree that you could, however much that went into her. What I want you to know, though, and any other mother of an adult child with BPD where this is going on right now, and it's heartbreaking and it's gut wrenching and it's so stressful and beyond. There aren't words to really describe it and do it justice. I want you to know that the other reason, besides that she's coming at you like bad, wounding dad, unconsciously, and repetition compulsions. The other thing is because your mom, and because somewhere inside she knows you love her, she will test, push, punish. It's brutal. And like you said, cruel. And all of that, though, means something else that moms need to know. It's all stressful, untenable, abusive, gut wrenching, heartbreaking. But know that within all of that, they feel safe enough with you to unfortunately treat you so badly. But you have to hang on to what does that mean, because there is some sense of safety that they can't realize or understand or look to or seek comfort from right now. But that doesn't mean it's going to be forever. But she does need treatment. And of course, you can't make her go get treatment. But I want you to know, it's important for moms to know that these kids, these adult children with BPD, who are so hateful, so cruel, so conflictual, so punishing, all of that, it goes on because there's something deep inside them that they have not really hung on to enough. But your safety to her for all of that expression. And I'm sorry to put it that way, but there is some meaning in a part of it, and the rest of it is just awful and heartbreaking, like you're describing. Yeah, and as your heart's breaking, the commenter says, I keep getting hurt by her cruel words and actions, and it's even harder to watch her live in constant emotional turmoil that she attributes to me, to you. I hear you on that. And just know that though she attributes it to you, that's a really kind of like 2.5, 3 year old kind of still arrested emotional development response in repetition compulsion cycles to what her trauma was. So she keeps attributing everything to you, A, because underneath it all, you're safe, if you know what I mean, and B, because you're object of the representation of bad dad. So part of, like, aside from the strategy I've alluded to that I would, if you want to book a session, I could really help you with, I would say the other thing you need to know more about and how to respond and how to change what you have been doing so far as you've described here that will help you and could down the road get your daughter to have some other kind of response. I'm just saying could. Won't be the big fix sort of thing that she needs from therapy. But the other thing is, yes, you need to do some more work to be able to deflect what she's throwing at you that's very hurtful, to be able to put space between that and where who you are and what you're feeling, because it's all being aimed through you at her dad. And I'm sorry that you're going through this. And there's so many mothers going through this and more like you are with an adult child with BPD when because like a high percentage of people with BPD do have a cluster B parent. Well, she did have a cluster B parent that abandoned her, right? But it's not always mom. So yeah, so I think like the major reason why she probably has all these patterns, all these behaviors, and undiagnosed right now borderline personality disorder, it's because it was at the age of 2. Because you haven't said, nor should you say, for me to do it, read in a public or anybody to read in a public forum. But I'm going to suggest to you that also when her dad was there for the first 2 years of her life, that somehow that was injurious to her as well, which again, don't blame yourself for. So not only is abandonment, but kind of what was happening in the environment as she was born into that environment, which again is not your fault. And then the comment says, I may have some codependent traits, but I'm trying to work on that. But no matter how much I try to preserve an emotional bond with my daughter, I'm feeling pushed away, punished, and turned into a source of all of her problems in life. Well, and I'm sorry to say that's exactly what's happening. But when they can find some help, and if she's in her early 20s right now, it could be rough for a while, but the hope is that something will change and she will seek help. And just know that you matter, Mom. You really do matter to her, even though she can't show you that at all right now, because she's projecting all the wounds from dad and blaming you. And there's nothing fair about that. But there's still hope that she may get help at some point and that she will learn this. In the meantime, you have to be able to learn more strategy to take better care of yourself. And I'm not saying there's some perfect strategy that makes all the pain go away. No, I'm not saying that. And yes, I would agree from what you shared here that you do have some codependent traits, but yeah, working on that. And then there's a strategy that I'm talking about that I really can't explain here because it would be irresponsible of me, and because I can only go so far on YouTube or in on the podcast and in responding to comments or giving information, because the next steps, this is not a replacement for therapy, or in your case, like the strategy that if you don't want to work with me, that it will only take you maybe 2, 3 sessions to really learn some things that can help you with your pain, your stress, your broken heart. And you're going through grief, but it doesn't mean that that grief is forever. But right now it's the loss of the connection that you had with your daughter that she can't come anywhere near you with, to pick up or acknowledge or be consistent with, because she's totally in the trauma and response to that trauma and manifesting all of said behaviors like a person with BPD, obviously, like she is, but it's all in response to her dad. And now you're taking all the heat because you're safe for her to play all that out with. Now, that doesn't mean you don't need to learn some more strategy. And you said you're working on your codependency, because you shouldn't just be there to be that punching bag at all. But it is different for mothers than it is for significant others. And I really feel for you. You said it truly is the most painful experience ever when it's your own adult child. You're absolutely right about that, because who would know that more than you and other mothers or fathers of adult children with BPD? Because I'm not even going to pretend to know that. I'm not going to pretend to say that I understand your pain. I've never been a parent. I was the child and then adult child of a cluster B mother and father who were alcoholics. And then I know where my four core traits, maybe five, don't know, wasn't assessed properly, BPD came from. And I can tell you this much, not only from clients I've worked with, like yourself, like in like moms or dads of an adult child with BPD, that what I know from my experience is that I didn't have a parent to turn back to ever. Okay, unlike your daughter has you. And when there's a parent there, and especially if she can get into some treatment at some point, and she's still young, but I know it's really rough right now. But when there's a parent there and you're there, you need to learn to take care of yourself more, react less, don't defend, don't pressure her to do anything, because you might look at boundaries and etc. and strategy, but she will at some point hopefully need help somehow. And then get some, hopefully. And when they do that, they always come back to the loving parent, to the parent that wasn't the abandoning or quote bad parent, or yeah, the wounding parent. And why do I know that? Well, because I've seen that with so many clients that I've worked with, moms or dads of adult children with BPD. They will come back. They need some help. They need some time. It's going to be rough. That's why you need to be able to take care of yourself better in this situation. Meaning, what's better mean? In ways that actually you will be able to handle the emotional heartbreak and the pain much better. And you'll be able to put a little bit of, like, I don't want to call it protection, but space between how much she's able to hurt you, and that's important for you right now. But what do I know from my experience? That I had no parent to go back to because they were out to lunch and they were ragey and they were alcoholics and there was nothing there. When I got into treatment, if my parents had been, if one of them had been different, I would have gone back for sure. Like, we had nothing but they raged and conflict back and forth. They were always raging, screaming at me because I was a scapegoat, which is not your experience, not what you did with your daughter. And then, so I was in this position. And then when I went to therapy, I actually had to work the opposite direction, right? I had to work towards no contact because of how ill they were and how abusive they were. But in your case, and a lot of other mothers' cases like you, who are not personality disordered at all, and you love your children very much, and she probably knows that somewhere inside, but it's lost at the moment, sadly, but it doesn't mean it's gone forever. She will turn back to you if she can just get some therapy. She will. So you have to think about that, but you have to just learn maybe to cope a little bit more effectively in the here and now, for the now, and taking it sort of not necessarily one day at a time, but being in the present moment, because it's going to be all about whether she seeks treatment or not. And often when they're in their early 20s, they think they know everything and they got it all handled, but because they think their problems are everybody else's problems, like it's everybody else and not them. But give her a little time, and something, I hope it's not something too serious that befalls her or that happens, but something may help her into wanting to get some help. And then a whole lot of things can change after that if she sticks with it. You said, and it's not that easy to distance yourself. So yeah, last sentence again was, it truly is the most painful experience ever when it's your own adult child. And yes, unmatched, unparalleled. I totally hear you. And you are totally correct about that, even though other people would think, but wait a minute, I'm in all this agony about. Yeah, we can't measure pain, but you're right. You're right as a mother. And lots of fathers are feeling what you're feeling too. And there are some adult children with BPD out there who have good mom and good dad, and they still have BPD. And it's not just all genetics, even then, just saying. And you said, so it truly is the most painful experience ever when it's your own adult child. And it's not that easy to distance yourself, even if it could spare you suffering. I totally have nothing but compassion, empathy, and I hear you. And what I want to say to you is, it's not that easy to distance yourself, even if it could spare you suffering. Well, what I'm trying to suggest to you here, and any other mother or father of somebody with BP that's listening, is that I'm out here to work with people, and I can only speak for myself and what I know I have to offer. I can help you with strategy to learn how to cope with this more effectively. And it might involve some distancing strategies, but they're not the kind of strategy, it's not the kind of distancing that is cold or mean, or it's how do I describe this? Because I think what you need right now is the strategy I'm talking about, which may or may not kind of feel like distancing to you or your daughter, but it doesn't have to for you in a sense. But it would be you working through some strategy and adjusting some things emotionally, and then looking at those codependent traits as well. And what I'm trying to say to this commenter, and by no means, I mean, you don't have to choose to work with me at all, but I'm just saying I really think I can help you. And that I've helped many other parents of an adult child BPD when neither parent is cluster B personality disordered at all. And I think the other thing is, so when you say it's not that easy to distance, the kind of strategy I'm talking about is not necessarily even distance. So you might be interested in that. And the other thing is, so this strategy, for example, isn't exactly all about distance or distancing per se, but you said, that's really hard to even think about because, even though it could spare you some suffering, you're not sure what that means or would look like or mean for how much you love your daughter and how much you still want to be there and and show her that, whether she's getting it right now or not. The key thing that I want to say to you as a mom of this adult child with BPD, that's your daughter, who you love, who you had some closeness with, and you probably will again in time, but it could be quite a while. She needs therapy. I want you to know that you deserve to bring down your sufferings home so that it's more manageable for you, so that your whole life isn't taken up with this heartbreak, pain, and the actual grief process that you're in. And what is this grief process about? And I work with parents of adult children with BPD all the time to explain all of this. And it is unfortunate. I'm not trying to withhold anything here. It's just unfortunate that it'd be irresponsible for me to start trying to lay it out here, because I really need to know who I'm talking to fully if I'm going to go further. And so just know that you do deserve some damping down and some resolution of some of your suffering so that you can have a better quality of life yourself right now, even when your daughter is where your daughter is. And that doesn't mean you're never going to feel the pain of that or worried or scared for her at all. So I just want you to know I really hear you. And I'm not going to say I know how you feel. I have a strong sense of how you feel based on all kinds of clients I've worked with. But I'm not going to say, I've known all my own pain, and people in other relationship types with borderlines know all that pain. But I do give deference to the non personality disordered parents of an adult child with BPD, because I actually have a list, and I don't get over there enough. I'd like to find somebody who could really run it effectively for me, but not a list. I do have a Facebook group, and man, I never get there. I got to get back there. Not that I contribute to the group much, but I mean just to let people join the group. But so and there's other Facebook groups out there, but the group that I run is, I mean, I only mention it to say anytime that I've read some of the posts that they share, it's a small group, it's not that active a lot, but it's heart-wrenching to read. So I really do hear you, commenter. And if anyone else out there is a parent of an adult child with BPD and you're not personality disordered, and even if you are somebody with BPD yourself and you've had some treatment and now you don't know what to do, I would work with you. I really will. I don't normally work with cluster B parents that have caused the issue for their children in different ways, but not this mom has not done that, and her father unfortunately did. But there are lots of people that I've worked with prior, parents, it's mom and dad or both. They might have some codependency or something stressful in their lives, but they are not personality disordered at all. And yeah, children, you can still have a child with BPD. And I just want to stress again, it's not 100% genetic at all. Because there's somebody out there whose information I'm going to be challenging majorly coming soon. But in the meantime, to this commenter, and if any other mother comes along and sees this on my channel or hears it in the podcast, please just know that I can't fix it all for you by any means, but I can help parents to cope much better with effective strategy and learning to understand, to work on your codependent traits, and also learning how to really put space between what they're pummeling you with emotionally and the words and the blame and the punishment and the revenge and the cruelty, to where they're not even seeing you at all, and how you can learn to put space between that and how you're feeling and reframe it. And it doesn't make everything go away, and you're still going to be really worried about your adult child with BPD, and you're still going to be really experiencing some things from that child with that child, adult child, but you can really pull back and change the degree and the level to which you're suffering. And I think that every mom or every mom and dad who's non-personality disordered and has an adult child with either BPD or NPD really deserves to find that space within and to learn more about not reacting, not defending, and to learn more about how to respond, and then all the times when it's wiser not to respond at all. And you don't do that in a cold-hearted or cruel way. And so I can explain more about that to people in sessions where it just be irresponsible for me to go too far here. So I wanted to really say to the commenter that I'm glad that something I said on some video was the insight was, and support for people with BPD loved ones, that something there was at least a little bit helpful to you. And I hope that this will be helpful also to the commenter and to any other parent, mother or father of an adult child with BPD or NPD, that, neither of you were personality disorder. And in this case, the commenter is the mom, and she definitely wasn't the source of how how her child, now adult child, ends up being, with all these patterns of borderline personality disorder and all the behaviors that go with it. And it's extremely painful stuff. And I know that one of the things I see a lot of the parents I've seen over time on the Facebook group that I have discuss is every parent's different. There are parents that are checking out. There are parents that can't do it anymore. Um, it's different. And then I've had clients. I've worked with some moms of an adult child with BPD, and they're not personality disorder people. And I've cried with them in sessions sometimes because like I remember one client said to me, and this was quite a while ago, like a few years ago, but in just talking about her adult child with BPD, the first thing she told me up front was, and of course she was angry, and not at me, but having a lot of anger inside and a lot of pain. And the first thing she said was, "I don't care what you say, I'm never giving up on my kid." And I respect that. I respect when parents are definitely like they'll just never give up on their kid. I think that that's super amazingly healthy and loving, but you need strategy and to learn how to take care of yourself better and how to deal with the person, the adult child, your adult child with BPD, because the mantle of your suffering and the humongous nature of your pain, it like sometimes in codependency, and I think moms more than dads, but some dads may feel like if you're not really up in all that, you don't care or love this adult child. And that's not true. And so I would encourage anybody who's a parent, the non-personality disorder parent of somebody with BPD or NPD, adult child, to really think about working with, if like I'm out here to work with you, I resonate with you, helped a lot of parents of adult children with BPD. But if it's not me, then please do find an expert who does this work also, because you do deserve to be able to find some peace, some space, dare I say, even some joy in your life, but that will always be somewhat affected to a degree by where your adult child with BPD is right now, especially when they're not being treated, especially when they're in their early 20s or their late teens, or maybe regardless of their age. But there's a lot to handle and deal with there. And so there's a lot of strategy to boundary setting that isn't about ever saying anything to the person, to your adult child with BPD. It's about changing the way that you keep taking all the punishment, the revenge, and the rage and splitting. And what can you do to help yourself with that that's not going to harm your adult child? It might not please them in certain moments, but behind all of the strategy that I'm alluding to, there is also, once you learn all of what that is, then there's also that component of not reacting, not defending yourself, and when are you going to respond versus when are you not going to respond? What are you going to do if you're not responding? Because we're trying to do this in a loving way to your adult child, not in a distancing or cold or hurtful way. And then how are you going to create different boundaries that you will learn more about by learning how to effectively strategize around taking care of yourself, but not taking and absorbing everything that the adult child with BPD blames you for, says, rages at you, screams at you, belittles you, abuses you about. And I totally understand how so many parents, I mean, you parents are amazing parents, unlike the parents that I had, that I ended up with BPD, which I, recovered from 37, almost 40 years ago. But your love and dedication to your children, regardless of BPD or NPD, is, to me, who didn't really have a parent, if you know what I mean, I had two of them, but they were crazy, is something to behold and is something very special and says a lot about you that's so positive. And so you deserve to be able to find better coping strategy to not be in as much pain, as much grief, how to manage that grief, that pain, and how to, without protecting yourself, be able to choose and learn about different ways to respond and times not to respond, where you can really start to take better care of yourself so that you can be suffering less. I can't say that you wouldn't suffer at all, but so you can be suffering less. And I really hear this mom of her adult child with her adult daughter with BPD. And thank you for sharing what you did. That, I hope you're finding other things helpful out there too, because I haven't talked a lot about different relationship types other than significant other relationships, largely with people with BPD. And that's changing now with the Surviving a Borderline podcast. And so, what I'm kind of saying to you, mom out there, and any other mom or dad out there of an adult child with BPD or even NPD, is that you do need to survive the quote borderline, the personality disorder that's happening right now for your adult child. You do need to survive that. You do deserve to survive that. What does that look like for parents? It's minimizing your pain and suffering and still being open and there and not being cruel or mean to your adult child with BPD. So I hope that was somewhat helpful. And there is always hope. And yes, the hope rests on when they will get to treatment, and the fear and worry rests on what's going to happen to them that's going to drive that. Because they will have to have more life experience, that hopefully will, I mean, sadly will increase their pain, that hopefully might get them asking more questions. Like, why does this keep happening to me? Why do I feel like I feel? Why do I hurt this bad? Maybe they suddenly, soon, or at a different age, it's different for every person with BPD. Maybe they will start to ask those questions enough that maybe without a diagnosis, maybe without talking about the BPD, exactly, maybe they'll reach out and want to go to therapy. And maybe they'll start to get some help, if not the full on treatment that people need for borderline personality disorder. So to moms and dads out there and or siblings of a person with BPD in the family, the adult child or a sibling, it's pretty complicated and it's pretty painful, but it's really different for parents because some siblings may go no contact if they have to, or back really far away, or not be as targeted as in this case, mom is being targeted because of bad wounding dad, and mom is being targeted and hurt and raged at and punished and experiencing a lot of cruelty from her daughter, unfortunately, because mom's safe. Even though your daughter never looks at you like you are who you really are. And like that she knows right now that you really love her as much as you've always loved her. So hang in there. And I would encourage anybody that resonates with what I said, if you're a parent, if you would like to do some of that, it's strategy to learn, things to practice. It's not just, I don't just use the DBT stuff because some parents go to DBT for families, and that's all wonderful and good too. But I go deeper than that, and it's much more holistic, practical ways that you can learn to stop reacting, that you can learn as a parent of an adult child with BPD to stop defending yourself, that you can learn that you don't always have to respond, and what does that mean and what does that look like, and that when you do respond, yes, there's a key thing in that response, which needs to be a sort of not saying anything or reacting to anything about most of the content that might be fired at you. But if there's something that the adult child BPD says, other than like you this, you that, then if they say something about how they're feeling or how something feels really impossible, that you can take those moments to say, I really hear you. And that must be really difficult for you. So some validation. And then say, oh yeah, well, you might not want to say more than that, but then you might also add, just know that I love you and I hear you and I care how you feel. So it's like trying to look at what you can validate, but what you need not to be reacting to as much as it's human to react to it or responding to, and certainly not defending yourself. And then there's this other area of like pushing them. You want to hold them accountable, of course you do, and you want them to take personal responsibility. But maybe more often than not, it's wisest to stay out of that because that's where a therapist hopefully will come in at some point in your adult child's life. And in the meantime, you need not to try to be that therapist because how are you going to be the validating parent when the opportunity to validate presents itself and not the reactive defending, responding to everything dance partner in the repetition compulsion trauma response, at least, well, for many, and sometimes it's perceived abandonment if it's not actual, like this commenter's adult child because of cluster B dad and the abandonment. And I just really hope that at the very least, that if you're a parent hearing this or the commenter, that you know that it's not your fault, like in the case of the commenter who her adult child dad was a cluster B, and that seems to be probably where the woundedness and what's largely caused the BPD. And that happens often. But then, like I said, there's moms and dads who neither are personality disordered. And then really what's happening largely for a lot of people with an adult child or child and an adult child with BPD is that this is why in the definition of borderline personality disorder, it says, one of the core traits or reason, descriptors of borderline personality disorder is, fear of abandonment, but the abandonment that may or may not have been exactly real. Maybe they had actual abandonment, and for many, they have perceived abandonment. And that gets into a whole other thing about some genetic component potentially, but that's not the whole enchilada. The other explanation is this the neuroscience of development in the womb, and then we're not blaming mom for this either necessarily, or just every mom, but some children are just, for a various variety of reasons that are somewhat known in neuroscience, born with an extra sensitive temperament. And then when good mom and good dad try to just be there for their infant, and they're doing everything you can, and for parents that have 3 or 4 other children, all your other kids are fine, and why does this one have BPD? What's going on? Because you did the same thing for them all. The thing is, that higher need threshold can't be satiated in an infant, where there is, and it's hard to explain how this goes on in infancy, an infant to toddler where there is perception of abandonment, because need threshold is higher than what parents can satiate, but nobody knows that at the time. So that's another reason why sometimes when both parents, unlike this commenter, because the commenter is mom and not personality disorder, but her adult child, her child had a dad that was wounding, abandoning, and a cluster B. So, and again, I'd like to just reiterate, there would have been something going on in that environment as well, not mom's fault, but because of dad being a cluster B and then, abandons whatever happened, it would have been affecting this commenter's child, the 2 years when she was very young, when he had, depending what was going on in the environment. And that's what dad did. That's not what this mom did. And sometimes that's not even what's happening between a mom and a dad. And it's like, how did our kid end up with BPD? I think there can be there's something to genetics to a degree, but it's never going to be, I don't believe, proven, nor has it been, unlike somebody out there, Salerno, keeps on saying so erroneously, it's not all biological. And the key thing to know too is whether there's a genetic component or the trauma that this commenter's daughter went through with a cluster B dad, and who then abandoned her at the age of 2. That's real trauma. It's not so when irresponsible people like Dr. Peter Salerno say, because he's out there pretty much on his own, erroneously says that BPD and NPD are biologic and characterological disorder and there can't be any help for them. Good God, that's just crap. And anyway, aside from that, so BPD does have a very, very excellent prognosis. However, that can't apply to somebody with BPD until they get into the process of treatment. And that is a really difficult thing. But I would just encourage people not to park it 100% on genetics or biology, because it's just not true. And another little fact I'll just throw in here at the end is, and all the studies, and a lot of them are pseudoscience and Gemini Big Pharma, they don't prove anything at all. They're not scientifically proven, they're not replicated, they're not critiqued. They're just like ideology put forward as like scientific fact. And the thing is that they say, but we study the brains of people with BPD, or I don't know, maybe even NPD. But what they're seeing there is already the changes of perceived or actual abandonment. They're seeing already what they're describing in the brain. Nobody knows, and I would suggest not that people are born like that with BPD or NPD. No, this is already a brain that's undergone some stress, some trauma, some perceived abandonment, some actual abandonment, some trauma. And if there's no trauma, the perception of abandonment with a higher threshold of a more sensitive temperament can make all the difference in the world, even when mom and dad are doing the best they can and there's no abuse. So I just wanted to put that out there because there's just no way that this guy out there saying this crap is right. He's very, very not right. And there are so many people out there that, in their own ways, how they communicate things, definitely know that. And this guy, I remember actually I went to one of his seminars, and so I have that, and I'm going to revisit it. I don't know if we're allowed to record those things, but I did. But I won't disseminate it publicly, obviously. But I will quote him. And I'm going to be taking that up as soon as I have the time to rewatch that, to listen to a couple of interviews out there. And if anybody on YouTube comes by to see any video I'm doing where I mention this dude and you're somebody that's interviewed him or you're about to, if you're ever going to do it again, push back, ask questions, study something. Because most of you interviewing this guy don't know Jack. And so you're like hanging on like a little puppy to every word he says when you ought to be asking some serious questions and giving some pushback. Anyway, my heart goes out to this commenter out here to work with you if I resonate with you. I could really help you with some coping strategy and a little bit of the codependency, but I think that most of your issues, some of it might be a little bit of codependency, but it's largely that you're her mom and that you're missing the child that you love and always loved and raised and did everything in the world for. And that's so heartbreaking. But hopefully it won't be a like forever thing, because there's so much percentage chance that she will get some help along the way, hopefully sooner than later, and things can change. And one thing I know, because I didn't have a parent to look back to, they were there, but like, hello, they weren't there, if you know what I mean. They weren't healthy. That anybody with BPD who goes through treatment and they have a solid mom or mom or dad, they'll come back your way. But yeah, they need treatment first. So take care, and I hope you found this helpful.